this headache now one of the problem. So person when get brain tumor, if they get headache, and there's one or two things to notice about this headache when they happen for brain tumor. We say the headache they worse in the night or in the early morning.
Wetin person go see for the body if person get brain tumor? Wetin be those symptoms? E get symptom wey say if e appear like this, more na brain tumor dey sabi give this symptom, or you just get general symptom wey person fit get and e go point to brain tumor. And which one make we no use play? Yes, when we go notice for the symptoms too.
Okay, very good question. Brain tumors, yes, they get signs and symptoms. You know, wetin be say person go notice for body when go make am go complain give doctor, or wetin doctor go see go dey suspect say this thing fit be brain tumor. Some of the time, those signs and symptoms they no dey wetin oyibo dey call pathognomonic. You know, they fit no give it away say this person get brain tumor. They fit just suggest. You know, sometimes you see those signs and symptoms, you go to think say if it be this, if it be that, so you can get them further to arrive at the answer. But at the end of the day, the signs when person fit get, if it results from tumor when don't they grow, when don't they cause problem for that local area when it dey, or the tumor don't grow, it don't big, they say they cause problem for the entire brain. They increase the pressure for the entire brain. So when the tumor they grow in one specific area, they cause problem for that area. What you will see? Now it's important again to notice say the way we go to design the brain is very intriguing. Different location then get different functions when they do, and get different responsibilities and roles. Okay, so you get the kind of tumor when go grow for a certain area, you can they give you sign of say something they happen for this area. You know, they perform this role when it's supposed to they perform. You get the tumor that they call olfactory groove meningioma, for instance. That one they grow for what they call the skull base, where this the brain they sit down for front here. And those when they pass enter the nose, when they help person they perceive odor, perceive smell, then they around that area. So if the tumor they grow, they increase in size, go put pressure on those nerves, and the person no go feel they smell things, no feel they perceive odor like before. So and usually now women, this thing they happen, this olfactory groove meningioma. So woman go they cook, food go they burn, you no go feel get jam. So that thing, if it results from any other a lot of other conditions, but something like that, it can give a clue as to say brain cancer or brain tumor dey for the background. That same tumor, the area when they grow, now what they call the frontal lobes, the place of the part of the brain when they help you the reason intellectually, you know, like a higher being. Okay, the part of the brain when it helped differentiate adults and children based on the way they behave. So when tumor don't they grow, don't they put pressure on that area, you see person when they say they behave normally before, you can't behave like say again mental problem. In other words, sometimes brain tumor they feel even present like saying a psychiatric case. But this is a person they mad, but now brain tumor they put pressure on the area when the head person they reason well. Okay. Another common tumor again, what they call pituitary adenoma or macroadenoma. When we say the area when they grow, now where the wires when they come from the eye, they connect the eye to the brain, the head person they see and they grow. So if the tumor don't grow, it will put pressure on that area, and it will disturb the one person they see. Most of the time, they will present with what they call loss of side vision. So they look, you know, say if they look straight, you see they see things when they're side. But those people, when we say if they get that tumor, they look straight, they see only waiting they straight, they know they see the side. So you see person they drive motor, all of a sudden, bike man go just enter front. You know, go see him when they inside before. You just see him when they enter front. So another example with that. Then you know, say I've been talking of children. Say children too then get tumors. Usually, most of the tumors when they happen for children, where they call the posterior fossa, the back of the brain, and it's in the day. So it get wetin they call the cerebellum, the little brain. When we say the work and the function now to help to give you balance, to help fine tune your movements, to help you move smoothly. When the thing don dey put pressure on that part of the brain, pikin wey don learn to waka before, you come dey waka, wetin dey call steady gait, you no fit waka well. Okay. Again, the children go fit dey complain of headache. And in fact, say earlier I talk say the brain tumor, e fit don grow to the extent that you come dey cause problem when dey result from say the pressure inside the brain, the head don increase, wetin dey call raised intracranial pressure. This headache na one of the problem. So person wey get brain tumor, e fit dey get headache. And there's one or two things to notice about this headache when dey happen for brain tumor be say the headache dey worse in the night or in the early morning, and e fit dey associated with vomiting. So person go sleep in the night, headache go wake am up, go dey feel headache. In the early morning, headache go wake am up, go dey feel headache. Then you come feel like say you wan vomit, you come vomit, and then the headache go come relieve. You can also note again say person when dey vomit in the early morning, woman when dey vomit in the early morning, no be always because of pregnancy, e fit be from brain tumor. Have that at the back of your mind somewhere. Okay, so vomiting and headache, now those are signs of say the pressure inside the brain don dey increase. So those are common symptoms when person fit get if you get brain tumor, when you go complain give doctor, and doctor go check, you come do investigation to arrive at wetin exactly dey worry the person. Others dey when be say I no mention, but we just dey try to cover the main things.
So investigation, some test wey person fit do when the doctor go fit prescribe for person when if you know say problem don dey like that.
Yes, different tests dey when we say person fit take confirm whether brain tumor dey or e no dey. Okay, usually na after doctor don see person, don ask am question, wetin we call history taking, don ask these questions, don find out all these things, don probe, then you come still examine the person, check him body, check him hand, check him leg, use different tools, take the knacks, this area and that area, check him eye, check this one. Then you come get suspicion for your mind, say person fit get brain cancer or brain tumor for this area of the body. So the next thing to do na to confirm whether that brain tumor dey true dey or if it be something else. So the test wey dey do, you get one they call brain CT scan or brain computed tomography scan. So that one, the machine they go put person inside, the thing go create an image of in head, and not just in head, go create image of inside the brain. So it go fit help us see where problem dey and the type of problem. But even better than CT scan, you get one they call MRI, magnetic resonance imaging, when the fit still dey do. That one they show the image clearer than CT scan. The analogy one they use sometimes na maybe Nokia 3310. If you take and take snap photo, we compare am to photo when you take iPhone, take snap. Difference dey in the quality. And the MRI, they show the tumor clearly, and the CT scan, the two dey clear like that. Although it gets new advantage when some kind tumors, when we see na CT scan, na better for them pass. Those when they involve the bone, for instance. So at the end of the day, the doctor fit come know the tumor when they worry the person. Although that is still not the end of the matter, because after operation, they'll still carry the sample, sent to lab to go do further tests to arrive at the exact tumor when they worry the person. That's just to mention a few of the investigations one they do.
Chief, I want to ask you one question now. After you don't talk about the CT scan, the MRI, most people they fear, say for our country, they know they fit do brain surgery. Say doctors know they. But for this part of the world every day, help us throw light, maybe to give some people hope. Say yes, this thing they fit do one for our country.
Okay, thank you very much.